Welcome back. Now, what exactly do you know about HPV? It is a silent killer that is responsible for various cancers and diseases, and yet the awareness around the same remains quite low. My colleague Amita Badwa spoke to Dr. Nitin Shah, a leading doctor, and brought forth some insights and details that everyone should know about how to help prepare and combat this disease.
Dr. Shah, can cervical cancer be prevented?
So cervical cancer, like any other cancer, if it's detected in time, then it is definitely treatable and even curable. But unfortunately, in absence of screening, and as this virus is very silent, most of the time the patients come in a late stage, and that's the time where cures become very difficult. HPV related diseases can be definitely prevented by certain aspects of lifestyle changes, like not having multiple sexual partner, not having extramarital sex. Third, having good hygiene in the genital area, and in general using condoms before sex so that you have less chance of transmission from one to another. And the general debility should be prevented in the form of good nutrition, good exercise, good diet, cessation of smoking, etc.
Can you also explain the recommended age for HPV vaccination and why it is important to start at a young age? Does the right age differ for boys and girls? What happens if you miss that vaccination at that age?
HPV vaccines are licensed world over to start from 9 years of age. And most of the vaccines are licensed till the use of 45 years of age. So it's never too late to take the vaccine, even if you miss the doses in the early life. Now, why do you give it to young children who are as young as 9 years? Because this is a preventive vaccine, so it should be given before the sexual debut, and these young children, of course, are not sexually active. Also, for 9 to 14-year-old children, both men and women, or both boys and girls, they have a very robust immune system, so they respond very well to the vaccine, which leads to better protection. And whether it is a boy or a girl or a man and a woman, these are gender neutral vaccine, so they can be given to both the sexes right from 9 years of age onwards, as late as 45 years of age. But as I said earlier, the better.